our speakers. After the webinar, you will receive a quick survey online. If you could please take a couple of minutes to reply to the questions, it's very, very useful to improve our services. So without any further delay, I would like to leave the floor to our first speaker, Mr. Zung from IPSOS Business Consulting. Please.
Thank you, Delphine. Hi, good afternoon if you are from Asia, and good morning if you are from Europe. Okay, my name is Zung, and I am from IPSOS Business Consulting, and I'm here today to give you a quick overview of our healthcare system and, of course, the medical device market sector. Okay. So yes, there's only two main sections that I will have the privilege to go through with you today, and hopefully by the end of the presentation you have more understanding about our country as well as the business potential for the medical device market. So this is the big picture of Vietnam. Okay, for those who not familiar with our country, it has an S shape. Okay, it's neighboring China, Cambodia and Laos. It is a small country, slightly bigger than England, slightly smaller than Japan, for your information, but it's actually the 40th largest population in the world, which we're very proud of. The latest population is in the region of 94 million people, and it's growing. Right? Our urbanization rate is about 33%, and this is actually very low compared to our neighbor. So that number will grow rapidly. By 2030, we predict that there will be about 45 to 50% in urban area. Okay. We are in a golden demographic era now, which means that the 70% of people who are in working age, 15 to 60, dominate our population. So with that population, we have a GDP at around 210 billion US dollar, with a flat rate of 6.5 to 7% growth each year. Okay, it's one of the strongest growth in GDP in Southeast Asia, and that will convert to about $2,200 per capita annual income. Okay. In terms of healthcare, we reserve about 6 to 6% of our GDP for healthcare system. Okay, and that will convert to about 25 hospital bed per 10,000 inhabitants. Okay, so these are just some big number for you to understand the big picture of Vietnam and basically understand about our healthcare spending. Okay. In the following slides, I will go further depth into the medical device system and the healthcare system. Sorry for the text, it's a bit wordy, but I believe that this will be available for you to for the future reference. What in this slide, I divide our facility into three typical groups: the tertiary, the secondary, and the primary. So if you go from top to bottom, their size decreases. So in each group, there will be a common thing, common type, such as the public. The facility that funded by the public, the facility that funded by private. So within those two groups, we have specialized hospital, which specialize in specific diseases and healthcare treatment. We have poly hospital, which specialize in general healthcare problem, and we do have at the bottom there health station, who deal with minor healthcare problems. So for each individual group here, there will be different in terms of funding, either from central governments or from private source. Their procurement will be different. They might be centralized. There might be direct procurement from their facility. Okay. So I go through in terms of numbers. Okay, some more number for you, but don't worry. This number represents the key or official healthcare establishment in our country. Okay. If you look on the left-hand side, the number will add up to about 14,000 establishments. So this is the official record in our system. In actual number, because there's notable differences in our country compared to other, the healthcare professional who work in public sector usually open their own clinic at home for our office hour. So in the actual number, they should be record as another facility as well. So if you add all that number, the total number actually should be about 50,000 facility in total. Okay. There's another point to note is the number of facility in the north actually more than the south. So we look at the right hand side. I have narrowed down Hanoi and Ho Chi Minh City, which is the two biggest cities in our country. There's about 30 to 40% higher in Hanoi in terms of facility compared to Ho Chi Minh City. Okay. The reason for this is because of the central government is located in Hanoi, so they do have preferential funding in terms of budget. Okay. However, in terms of demand, I would see that Ho Chi Minh will get more because of their 10 to 15% more in terms of population, hence more in terms of demand. A bit more, so this is in terms of number of hospital. Okay, we have about 1,400 number of hospital in our country. Okay, 13% of which are private. Okay, remaining are public. Okay. So this number will cater for about 150 million patient visits per year, of which 7% are catered by the private sector. So with that number, you can see that the public sector are overloaded and overcrowding. That's the biggest problem for our healthcare system, whereas the private sector are underutilized. They are underutilized as much as 40% from our calculation. And the reason for that is the price. There's a vastly different in terms of price between private and public sector facility. In terms of accessibility, okay, mostly private facility will be located in urban area, in big city like Hanoi and Ho Chi Minh City. And one of the most important reason is the lack of well-trained and experienced staff in private sector. Even though they get more pay, but they're not attractive, well-trained and well-experienced staff. Okay, because of the very reason that I mentioned before. Healthcare professional in public sector, they usually open their clinic to treat their patient out of office hour, and that actually give them a generous income. Okay. So they actually stick with the public sector because they get that freedom to work and to earn additional income. Hence, they actually see a lot of patients. Hence, they build up their experience. So that's one of the main reasons why the private sector is in short of well-trained staff supply. In terms of medical equipment, okay, the number that we look at here is 7%. That is a flat rate increase from year to year. Okay, with the total market size forecast to be about 1 billion euro by 2019. Okay, and if you divide that by the number of population, okay, we have average spending about $10 or 7 euro per person in terms of facility investment in Vietnam. That is significantly lower than Singapore, Malaysia, and Thailand. Okay, and these three countries are considered as one of the top destinations for health tourists for Vietnam. So from our number, we know that there's about 10,000 visits from the middle and high income people who visit into this country to take care of their health. So this is a gap for our private market to fill. If we subsegment our market equipment device, okay, with the growth of 7%, you can see the pie increase from 2014 to 2019 there, from 700 million to about 1 billion euro. Okay. Consumable and diagnostic imaging still consume the largest portion with almost half of the market share. Okay. And actually 95% of our imports are coming from our import. Okay. Destination like the G8, and more advanced medical device country like Singapore and United States. The basic reason for this is we don't have the technical know-how and the facility to produce the advanced, sophisticated equipment, hence a large, significant portion of the imports coming to our country. If we move on, I divided this into import origin. So as you can see there, Europe 28 represent about 24%, so that is a total of 28 countries. Okay. So if you look at the top country, is actually Singapore at about 20%, and followed by Japan and China. Okay. With the exception of Germany in Europe, they command about 10% import into Vietnam market. Again, I don't see a vastly shift in terms of subsegment. The consumable diagnostic imaging still command a large proportion of the market share. Okay, moving on. Right, I took the liberty of dividing our end consumer into 4 different groups here to explain you the basics of their profile. Okay. So if you look at the top left corner, the first group is the government-funded hospital, so we could call it the public sector. Okay. Now they command about 70% of the market share, market demand. And for this group, their procurement will be very unique and different. They will go through the centralized system. Okay. For the other groups in the top right corner, the foreign-owned and joint venture hospital, they usually buy the equipment or they brought the equipment from the country of origin. But the bottom end on the left, we have medical and research center. Yes, they do consume equipment. Most of the time are advanced and highly sophisticated equipment for their research and development activity. Okay. They only account for a small portion though of the market consumption. Okay. Last but not least is a local private hospital. They show the highest strong in terms of growth rate, okay, to cope with the demand of the middle income and high income consumer. They also support by the government to establish these private market to cope with the overcrowding and overloading of the public sector facility. So these are the main differences in terms of our end consumer. So what will kickstart or what will drive our market further, to stick with that number of 7% growth rate year on year and to forecast about 1 billion by 2019? There are three key reasons here. Firstly is the increased life expectancy. Yes, not only that reason, we have a strong growth in population, we have an aging population, we have a healthier population, which all convert to high demand of healthcare. Okay. We have an initiative and focus from the new government in terms of improving our healthcare system. Okay. They're spending money to improve rural facility, to tackle the imbalance in terms of services, to ensure that there's a high accessibility for rural population, okay, to avoid the shift of population from rural area into the urban area. So we have imbalance in terms of overcrowding in key city, okay, and underutilized facility in subsidy or rural area. Okay. We have international initiative, okay, funding from our donor, from our NGO, for our research and development, and also influx of new facility to support our healthcare system. So these are just some of the key factors that help our healthcare system to grow at a steady rate of 7%. So that will be the end of my presentation. Okay. Again, this presentation will be available for you to for future reference. Okay. And just a brief about our services. We are a French company. We specialize in both consumer research as well as consulting. Okay. We not only specialize in healthcare, we specialize in other as well. So if you do have any future inquiry, by all means contact one of us. Okay? We have represent office in about 100 countries. Okay? So it's really a global company. So I'm glad to help if you need to inquire anything. Thank you.
Thank you so much, Mrs. Ong, for your presentation, full of figures and very relevant information for people who are not in Vietnam yet. I would like now to introduce Mr. Vicent ARRECKX. He is Chief of Representative Office of URGO in Vietnam. This company is here for 20 years, if I understood well, but he will explain this much better than I. So please, Mr. ARRECKX, thank you for being here today with us.
Thank you, Delphine. I would like to welcome you if we are for Asia, from Europe. I am Vicent ARRECKX. I'm the Chief Rep of URGO International in FCP International in Vietnam. I don't claim to be expert of healthcare in Vietnam. I arrived 1 year ago, but I can share with you my experience, and I hope it will be relevant for you for your understanding of Vietnam healthcare market. So URGO in Vietnam is present for more than 20 years. We are a representative office in charge of the business promotion and in charge of implementing contract between our mother company and our local partners. In Vietnam, we are working with distributor Kim Do for more than 20 years. And our product are medical device for 80% and 20% are food supplement. We've got two different business units. One, URGO Medical, dedicated to hospital, dedicated to advanced wound care products for pathologies such as burns, such as diabetic foot ulcer, such as pressure ulcer, something like that. And our second business unit is URGO Healthcare, dedicated to self-care. And with this business company, we are dealing with pharmacies. So we've got the chance in URGO, thanks to our distributor, to be in contact with clients, both hospital and both pharmacies. Mr. Dung from IPSOS show us that there is Vietnam has a great potential because of the positive KPIs of the countries. I just want to highlight two KPIs. First one is the economic one. As you can see, the GDP growth is almost 6% for last 3 years. Inflation is very low. It's around 1 or 2% last year's, and the consumption is growing. It's the first point. In terms of demographic, as you can see, as you can imagine, Vietnamese population is very young. 42% of population is below 24 years. To give you a comparison, in France, a metro country, has 30% of his population below 24 years. It's the second positive data, and the third one, important one for companies who want to invest in Vietnam. Emerging middle class is growing. This middle class will grow by more than 3 times from 2012 to 2020. So it can represent a great opportunity for a new company to come into the market. So Vietnam is an attractive business environment for multinational company. It's also a great opportunity for medical device company. As you can see on the slide, the next slide, the medical device market is growing. It's going to reach 1.4 billion USD in 2018. And as you can see in my slide and also in the slide of Mr. Dung, 90% of medical device production cover 90% of total Vietnamese market. And the second very good news for a medical device company is step by step, we've got an harmonization of medical device international standards in Vietnam. with many circulars implemented, and the new medical device decree that will be adopted in the mid-2016. Some challenge we have to face in Vietnam, like in all new countries. The first one, personally, was the culture and language. Vietnamese language is quite difficult, and the culture is so different from Western culture. So it's important to rely on Vietnamese people that can allow us a good understanding of the market, of the problematic, of the way of thinking of Vietnamese people. It's a first challenge, and we can face it thanks to the help to other people, so the local people. And the second challenge we have to face, and the processes and red tape. Despite a real effort of authorities to simplify business red tape, the process can be a bit difficult to understand, and we need, as an international company, the help of local one or business community, such as UOCHAM. UOCHAM is the European Chamber of Commerce in Vietnam that was created in 1998, and it's one of the most active business community in Vietnam. Within UOCHAM, we created in January 2016 a new medical device and diagnostic committee with companies such as, of course, URGO, Abbott, Bayer, Bilbron, Johnson. And the idea of this committee is to cooperate as a partner with MOH, with Minister of Health, for regulation, market access, and other specific business issues. And this group is also an opportunity to share between other multinational companies about market. So I invite you, if you're interested, to join UOCHAM group. That can be an help to understand, to have a better understanding of Vietnamese market. So it will be the end of my quick presentation. I think time is now. As you could see with Mr. Dung and with my presentation, Vietnam represents opportunities, and please come and enjoy Vietnam business opportunities. Thank you.
Thank you so much, Mr. ARRECX. I just have one question before going to my presentation about the trade mission we will organize in Vietnam in September. You just mentioned this sector committee in EuroCham about medical devices and diagnostic. Is it open to companies not yet implemented in Vietnam, or mainly to European companies implemented in Vietnam? And only European, or also European, Vietnamese, and others?
As every group, every committee of EuroCham, they are open to all company member of EuroCham. This company can be American, European, or Asian company. They should be member of EuroCham. And then, depending on the committee, because I spoke about medical device committee, there is other committee, such as a pharma group or committee of other sectors. For each committee, we have to deal with a representative of the committee to understand well the different rule to be member of this committee. But the first rule is to be member of EuroCham.
Great. Thank you so much for this first information. For those interested, all the details of EuroCham and the sector committees are on the website, of EuroCham. Very easy to find on the net. Okay, just let me jump to a couple of information about EVBN. So EVBN, it's a co-funded project by the European Union. It exists since 2.5 years. Our objective here in Vietnam is to support European companies to develop their business in Vietnam by selling, sourcing, investing, building, etc. We have, of course, a great team of people already working for EVBN. I show you yes, you have everybody on this slide, knowing that EVBN means EU Vietnam, but we have colleagues in the region as well, in other countries like Philippines, Cambodia, Indonesia, Laos, Myanmar, Thailand, and different other countries. We have to support European companies in developing their business in Vietnam. We have implemented already a long list of services to support companies from all the 28 European countries in Vietnam and from, of course, different activity sectors. You can see this list of services on your screen. I will not go into detail. This is not the right moment for that. Just know that on our website you can access to a lot of information totally free of charge, and among those information you can find studies and reports. Those relevant for our listeners today are reports on healthcare and the one on medical device. But of course, the one on Vietnam economy and the SME Starter Kit are also very useful for those looking to develop their business on this market. One service that might be interesting for those companies looking for maybe projects like implementing a representative office is the business incubator. So we have offices to rent to European companies to start their operations in Vietnam. It's for a period of 12 months maximum, but it's a very good place to start in a very European environment, because we share offices with the European Chamber of Commerce, the French, the Italian, the Dutch, the Belgium, etc., and EVBN as well. The right place to access all the useful information, of course. Tailored services, many tailored services depending on your needs, depending on your products and services, market studies, business partner search, pre-market consultation, trade fair supports, etc., etc. What I wanted to share with you today is this event that will happen end of September this year, from the 20th to the 23rd of September 2016. It's our healthcare and medical device trade mission to Vietnam. We are very used to organize trade missions already, because we had on other sectors. We had trade missions on food and beverage sector, we had trade missions on lifestyle, interior decor, on green technologies, renewable energies. So we know already very well how to organize this kind of event, welcoming delegations of European companies to Vietnam. So we usually have delegations from 15 to 20 companies coming from all European countries. So this one, end of September, will be on healthcare and medical device sector. Any company from European countries is allowed to apply. EVBN will, of course, make a selection. Why a selection? For different reasons. The first one is that we don't want to encourage a company to come to Vietnam if we don't believe that they have potential in the market, or if we don't believe we are the right person to support them. And the second fact why we do a selection, it's because this event is subsidized. We are allowed to support you financially with European funds, and of course we need to make sure to allocate those funds to the right companies showing great potential on this market. Subsidized doesn't mean that we give you money, no, but we spend money on your behalf, which allows us to offer a low price, a low fee for this event. So we will cover accommodation, domestic flight, interpretation, etc. And most of all, what is most important for you, we will make sure to organize tailored B2B meetings for each one of the European companies participating. So participating to this mission, you have, you are sure that you will meet right partners. An average of 8 to 12 meetings is usually what we experience so far in both cities, Hanoi and Ho Chi Minh. And when I say an average of 8 to 12, it's in total in both cities together, Ho Chi Minh and Hanoi. This is the agenda of the week we suggest you to participate to. So you all have to make sure to arrive in Vietnam on Monday the 19th of September, and you will be extremely busy from Tuesday the 20th of September in the morning until Friday the 23rd in the evening. In between, we will organize a lot of things. You can have the detail on your screen. The most important days are Wednesday and Friday, with 2 full days B2B meetings, one in Ho Chi Minh and the second one Friday the 23rd in Hanoi. This is of course the key point of this mission to Vietnam. In between, you will have information session with experts coming to share their experience on the ground, how to work on the Vietnamese market, how to negotiate with a potential importer, distributor, potential partner, how to sign a contract. We have in EVBN staff legal, we have our lawyer, legal consultant, sorry, I missed the word, legal consultant, and she's right here in front of me, so laughing when I was looking for my words. So Ms. Tao is here. You can have her details on our website, and she's here to reply to all your questions, and she always participates to our info session because, of course, she can share information on how to sign a contract in Vietnam, how to make sure you are covered, etc., etc. This mission will happen in Ho Chi Minh in the second half of the week during the fair, which is called Visit Farm Medi, and it will be also the opportunity to visit the fair, of course, during the mission. Here you have some example of trade missions we organized in the past. So the picture on the left side is the info session, so the very first day, very first morning. So you can see the delegation of European companies listening to the presentations. The second picture on the right is an example of the B2B day. So we have a big room in a hotel. Each European company has its own table, own tailored agenda, own translator, and all the meetings during the day. Another example was the trade mission on lifestyle interior decor, basically the same setup in a hotel, and tailored meetings all the day. So this is the healthcare trade mission we offer you to join in September 2016. If you are interested, please feel free to contact us anytime. You have the details, well, you have my details on this slide. I'm Delphine ROUSSELET, the project director. You have my email, and you can find other details on the website. And Ms. Anne is our business development officer, who will supervise this organization, this trade mission. So feel free to contact any of us anytime. It will be a great pleasure to welcome you in Vietnam. So we are now going to jump to the Q&A session. I saw during the presentation a lot of questions coming, so that's why I was sometimes a little bit distracted. Sorry. Let me have a look. Okay, so this is a tricky one. I'm just asking the question, and let's see which one of our speakers will pick it up. It's a tricky one. Encouraging international initiatives. Does this mean registration is easy for CE class? Oh my God, I have to read as it is. CE class 2A? Does it mean something for you? No. Okay. Does it take a long time? Okay, so let's maybe just share information about registration. We know it's not easy. That's not the right word for sure. Tao, if you would like at any moment to take the microphone, feel free. But first, maybe our speakers, if you feel like sharing information about registration. Just a couple of words on how to register a product in Vietnam. Okay, where this question comes from, because you just...
Can I have a look at the question, please?
Registration. Okay.
Encouraging international initiatives.
CE class.
Even if it's not specifically about this class or registration.
Well, thank you for the question. And first of all, I just think I'm going to just give a very general overview on how to entry the market. So for pharmaceuticals to be sell in Vietnam, you need to register and got approval from the Ministry of Health. For the detailed procedure for the product that you mentioned here, I'm afraid I would have to look to have a look further into the detailed procedure. For the general market entries, Vietnam is making a very big step, and they try to make it easier for foreign investors to come into Vietnam, and they do realize that opening the market is doing do give the positive impact for Vietnamese consumer. So in the future, I can see the trend that the Vietnamese government is trying to open the market more, and it would be easier, and the procedure for registering would be easier for foreign investor to export into Vietnam as well. And for further details about the CE, the product that you mentioned, I will have a look further into it and come back to you. I hope that's okay, acceptable. Thank you.
Thank you so much, Tao, at least for trying. It's a difficult one, but of course we can look into details after the webinar and come back to you, because we have the name of the person who asked this question. We know who you are. We will reply to your question. We have other questions. Okay, thanks. I can see your thanks. Great. We have other questions. I do have to admit that they are quite difficult. I will read them, but we will also look into details and come back to this lady who asked the question after the webinar. I read the question. First one, do you know the procedure of the import-export of sample collection tubes for a laboratory test that falls under the declaration of in vitro diagnostics, but the analysis will be done outside Vietnam? Is possible without restriction or not? Well, I don't pretend I'm an expert on this. None of the person around the table is. They are all shaking heads. Being very professional in their respective sectors, this is a very tricky question, so we will analyze it and try to come back to you, if possible, after the event. Another question also coming from a lady, is there a national scheme for hematology testing? If so, what's the regulations for EU companies that would like to enter Vietnam? This is a very precise question. Thank you so much. We don't have the reply right now to this question. So we will try to analyze it and come back to you, of course. If after the question, after the reply, sorry, you feel there is a potential for you in Vietnam, so we will then be happy to welcome you in September. But I do understand that you need first to have the reply to this question. Okay, any other question?
Actually, I have a question for Vincent. Well, we've been here in Vietnam, and I think you could share with us the experience of distribute your products here, Vincent. I think that's one of the curiosity of many people here. I think we have a first-hand experience here from Vincent, I think, who can share a bit of experience in terms of distribute his product in Vietnam.
As many pharmaceutical companies, we are working with distributors. You can take contact with URGO, with EVBN, and we'll be very glad to give you some contacts of distributors in Vietnam. You can find European distributors and also local one. Both have got advantage. So please free to ask us some reference. We'll be very, very glad to give you this. Thanks.
I have another question, which is a good one, because some people might wonder how EVBN works with the EU representatives in Vietnam. So I have the question from Netherlands, I believe. How does EVBN cooperate with the Dutch embassy? We cooperate not only with the Dutch embassy, but with all the embassies, European embassies in Vietnam. Not only the embassies, but the consulates, the chambers of commerce, the business associations, any national representative, which makes our days quite busy, because 28 countries is a lot, and almost all of them are represented in a way or another in Vietnam. How do we collaborate? Very easy. We share information all the time. We share information about our events. We try to make sure we don't step on anybody's toes. We try to make sure we fill the gaps. We try to make sure we offer the right services at the right time, at the right price, to companies who maybe don't have support in Vietnam. So I'm talking about the companies coming from European countries without representation in Vietnam. So those companies are really, really looking for institutions like EVBN. And when we have trade missions like this one, for example, coming in September on the healthcare and medical device sector, what we do is to collaborate with the national chambers of commerce and, in general, EU member state representatives. For example, if an Italian company participates, we try to ask the Italian Chamber of Commerce to work with us and arrange the tailored B2B for this company, and et cetera, for other countries. This is the way we work. I don't know if I replied to your question. If not, feel free to send another one. We are coming close to the end of this webinar. I can see one question. Please send the presentation slides or the whole recording to me, to you after the webinar. So kindly note that all the webinar, is recorded, and you will find it on our website maybe tomorrow morning latest. Well, tomorrow morning Vietnamese time, because here it's 4:15 afternoon already. So the time to make the file and put it online. You will find the record, and you will find also the presentation of our speakers. They both agreed to share on the website. You will have their details, so of course, should you need to talk to them, share with them, I believe they are okay. I am, of course, as well, so you will have all our details on the website. Feel free to also look at the reports we have on the websites, so the report on healthcare sector and the report on medical device sector. Okay, we are now at the end of this webinar. I would like to thank our speakers for participating today. Thank you so much for your time. I know you are all very, very busy, so it's really valuable to have you today with us. Thank you for all the internet users who listened to this presentation. Thank you for your questions, and looking forward to welcoming you in Vietnam in September during our trade mission. Thank you so much.
Thank you all.
Thank you. Bye-bye.
Bye.
Thank you.